I'd like to welcome you this morning to the state capitol and especially say a happy holiday, Merry Christmas to you. We have an exciting agenda this morning. Of course, we're here to present Senate Bill 14. Senate Bill 14 has been in a long time in progress. If you recall, we started out with the Senate Aging Committee Study Committee, and we have met 2 times this summer and fall. And this legislation is a result of that study committee. The purpose of the committee is to bring forward Senate Bill 14 that talks about the future impact of Alzheimer's disease in the state of Georgia. It will examine the existing industry, services, and resources addressing the needs of Georgians afflicted with the disease and its effect on their families. It will develop a strategy to mobilize a state response to the public health crisis. Georgia is one of 16 states, and I couldn't believe in our study committee when we found that out, because Georgia usually leads the nation in a lot of different health care issues, but we're one of 16 states that are left in the nation that has not developed a statewide plan. The plan will set the groundwork for the infrastructure necessary to build the dementia-capable programs and services for the growing number of people with the disease. Over 5.4 million Americans are living with Alzheimer's, or 1 in 8 Americans over the age of 65. 1 of 8 Americans over the age of 65 has Alzheimer's disease or related dementia. The dementia is the 6th leading cause of death in America, and it's the 5th leading cause of death with people over 65 years of age. There is an expected 45% increase in the number of Americans expected to have Alzheimer's from the year 2000 to 2025. Almost 70,000 nursing home residents currently in the United States have cognitive impairment disease now. At least 800,000 Americans live alone with this disease. And I know this is a lot of statistics, but over 15 million Americans provide unpaid care for a person with Alzheimer's and related dementia, and 80% of care is provided at home is delivered by family caregivers. And it doesn't matter where I go. When I started talking about Alzheimer's and dementia, it seems like everyone you talk to, they say, well, I have a family member, I have a mother, a father, a grandfather, or they know someone that is a caregiver. In 2007, the Georgia Medicaid program was the primary payer for 74% of nursing facility residents, and total state Medicaid long-term care spending for older people and adults with physical disabilities exceeded $1 billion. $1 billion. Even if individuals pay initially for their long-term care, most will deplete their assets and meet Medicaid eligibility standards in a short period of time because of the cost of care. And I think that's one of the most tragic things I've seen. It doesn't matter how much money you have. If you have your little nest egg and your 401k, and this is the frightening thing about baby boomers, that they're going to deplete that income, and unfortunately they will be dependent upon Medicaid and Medicare and become a dual eligible. These are daunting statistics for the state of Georgia budget that is already strained due to the long stance of the current recession. Georgia must be prepared with an active plan to share the burden of taking care of its citizens who are likely to require government assistance in the final stages of their lives due to the effects of dementia. Whether those services are provided in-home, community-based, or in a nursing home type facility, Georgia must be ready to improve its health care infrastructure. I challenge the Department of Human Services and Aging, the Department of Public Health, the Executive Branch, and the General Assembly to actively participate in developing this plan by approving this legislation. Now we have just a couple of speakers. We're going to keep it brief today because I know everyone is standing up and has Christmas to-do list. But we have just a couple of speakers. First, I'd like to call up Kathy Simpson with the Alzheimer's Association. And then after that, we're going to hear from Dr. Alan Levy. Dr. Levy is a MD and physician who practices at Emory University and at Wesley Woods, and he's also a researcher. And I have come to find out that the state of Georgia is very, very fortunate, even though we have been delinquent in not producing a statewide plan. We do lead globally in our research and our research capabilities that we've done on this disease process. And next, I'm going to have Dr. Alicia Easton, and she is going to be with Sheila Humberstone. And the thing that is interesting about Dr. Easton is that she actually already has the disease process. And lastly, we're going to hear from the Georgia Council on Aging, Catherine Fowler. And I apologize for not speaking distinctly. I had oral surgery, and most of y'all know I don't usually talk like this, but please forgive me. So first we'll have Kathy Simpson.
Thank you, Senator Unterman. We truly appreciate your taking a leadership role in introducing this legislation. We appreciate the partnership and support of all of the members of the stakeholder group, the Georgia Council on Aging, who also adopted the creation of an Alzheimer's and related dementia state plan as one of their legislative priorities this year. Alzheimer's is not just a little old lady forgetting. It's terminal. Out of the top 10 leading causes of death in the United States, it's the only disease that does not have anything to slow the progression, to cure it, and we don't even know what causes it. By 2050, we could have as many as 16 million Americans, costing the United States right now $200 million. If we don't take action now, we'll be further behind the curve in planning, so we truly appreciate the partnership of everyone here, Senator Unterman, and all of the other people who've helped to get us to this point to ensure that Georgians who are living with Alzheimer's, both those living with the disease, their family members, the medical community, the care professionals who care for them, those individuals, police officers, the entire community that it takes to care for someone with Alzheimer's. We truly appreciate your help and support and look forward to helping you get this legislation through. Thank you.
Leadership. It's a great privilege for me to be here today. This is one of the most important times that I've seen real advances and opportunities to make huge strides and take care of people with Alzheimer's disease. As Kathy and Senator Unterman have already alluded to, the numbers are horrendous for what's projected ahead for Alzheimer's disease and related conditions affecting our state. I'd like to just make it a little bit more personal. It's easy to talk about numbers, but you're going to meet in a minute Dr. Alicia Easton, who's one of my patients. I take care of patients regularly, thousands of people each year in this state, and every single one of the faces and families affected by this disease is horrendous. I've taken care of all sorts of awful medical conditions, and Alzheimer's disease is by far the worst. There's nothing else that robs people of our ability to think and remember. Even people can look in the mirror and not recognize themselves in later stages of the disease. It's Christmas time, guys. This is the time where families come together. What we see the time of year, people coming together, families saying, oh no, this is our last time that we might have mom or dad, that we're going to be able to remember what's happening. Let's cherish the moments we have. What I am particularly frustrated with is that there's never been a better opportunity in history to make advances. We can now diagnose this disease 20 years before people develop symptoms. We know if we intervene early, we can just simply educate, detect, diagnose. We can have huge impact on families, individuals, and finances of states if we are aggressive in moving forward with plans. So this state plan process is absolutely essential as a first step for us to really start making some important strides. I'd like to introduce Dr. Alicia Easton, who I think will also illustrate for you that the face of Alzheimer's disease is not one that you always expect. This is becoming such a common disease. 10% of people are under the age of 60 or 65 who are affected. And what we're going to see increasingly is Alzheimer's disease in the workplace, in our community, and we need to figure out how to help people continue to contribute like Dr. Easton. So, Dr. Easton, thank you for your leadership.
I have a niece who's 8 years old, and I like to think she's going on 18, or she thinks she's going on 18. She will have this to face when she turns into her early teens and when she hits into her mid-20s. And it could very well hit her in her mid-20s. It could hit her around 50. I was diagnosed at 46. I have this disease, and thank goodness I found Alan. I wouldn't be where I am without him today. And so I just wanted to thank everyone and to just keep fighting the fight together, and to know that we're doing everything that we can at Emory and here in Atlanta to try to bring some progress to this issue. So thank you again so much, and have a wonderful holiday.
Year. There are so many advocates who are stepping up behind this issue. The council itself began looking about 3 years ago at what was coming down the road. Senator Unterman putting together the Senate Study Committee on Aging this year, and this was one of the first issues that came to them, and she's acting so quickly on the issue. We really appreciate that. Certainly the Alzheimer's Association has been behind this for years now, trying to get Georgia to catch up with the rest of the country and get this plan. And then hopefully we can bring to the table the Coalition of Advocates for Georgia's Elderly, which is hundreds of organizations around the state that have chosen this as their #1 priority this year. My mom is living with dementia. My dad lived with it. Everybody in this room has been touched by it, and every Georgian is being touched. So we pledge to help you. Thank you.
I'm absolutely delighted today to bring forward all of these advocates. It may look like a small number, but each one of these advocates represents thousands of people, no matter what industry or what particular viewpoint they come from. There are many, many Georgians. I would especially like to thank Dr. Easton. This is only the second time she has ever spoken in public. And as you know, Alzheimer's is a disease that affects your memory and your brain. And she has very, very, very much courage to have the ability to come before the press, to come before the media, and to speak before people and talk about the disease. And her case is especially ironic when you listen to her story. I know she didn't tell her story today, but her story is just very, very poignant because it has affected her so young, and she is so brilliant and has traveled around the globe working on healthcare diseases. So I look forward to working with the advocates. I look forward to working with the Senate and the House, the Lieutenant Governor, the Speaker, and the Governor. The Governor is especially interested in this. We talked about it last year. We knew it was coming down the pike, so now we have an affirmation that Senate Bill 14 will be discussed and voted on in the Georgia State Senate. Thank you for coming today. I appreciate your time, especially at Christmas, and Merry Christmas.